Just because you have a jawline does not immediately make you a candidate for jawline filler. These are the 4 things that I am looking for in every patient to determine if they are a candidate for jawline filler. When I first started out, anybody who came into my chair requesting jawline contouring, I would be like, sure, let's give it a whirl. I didn't know how to truly select an ideal candidate for this treatment, and it quickly set me up for failure. Ultimately, the patient left disappointed, and I left disappointed in my performance. Then I started really understanding who the ideal patient is for this treatment. And it's not just anybody with a jawline. I really narrowed in and was super selective. And since then, every jawline I perform is a banger because I am very selective. Just like we're always selective with under eye filler, I'm just as selective with my jawline patients. And if you're looking to dive in deeper into all things jawline, please take a look at my Jawline book. It is all encompassing, a full anatomy review, complication management, including non inflammatory nodules and how to work through that. I show you my needle technique, my cannula technique, and you have step by step videos that take you all the way through all of my treatments with a variety of different jawlines. So take a look at that. You can click the link in my bio down below. But let's get into these 4 things and how I really narrowed it down to these 4 things. Number 1, tissue density. Woof, I could talk for hours on this. I could talk for hours on all things jawline, but number 1 is so important. All 4 of these are so important, but number 1 is really important. When you evaluate your patient to determine if they are a true candidate for jawline filler, you have to palpate that mandible. Touch, feel the mandible. If your patient, when you are palpating for that mandible, if you can't feel that hard, sharp mandible bone, because they have a lot of just subcutaneous fat that they carry there, just their tissue density is too dense there, and you can't really palpate the mandible, how do you expect a gel, even if you're using the most robust product on the market, such as Radiesse, Undilute Radiesse, how do you expect, if you can't palpate the mandible, how do you expect that filler to really shine? It's not going to be able to work its magic. If you can't feel the bone because they have so much dense tissue overlying that mandible, now it doesn't mean that the patient is overweight by any means. Some patients are leaner, but just carry a good amount of their fat in their jawline. If they have really dense tissue overlying that mandible, ultimately they're not an ideal candidate. I used to think that, oh, if somebody had a little bit of weight that they were carrying in the jawline, I could just inject filler right there and it would create this crisp contour. It doesn't. You can inject 10 syringes in that jawline, but ultimately that tissue is so dense that it's not going to allow that filler or product to shine and really push through that tissue. Because you have to go deep in that tissue, it's just going to mask the power of that filler. The ideal patient for number 1 is somebody who has a leaner feeling to their mandible, somebody who you could palpate. For example, my mandible, I can ride along the mandible and really I feel the whole bone. That means that I don't have a very dense layer overlying my mandible. I inject a little bit of filler and boom, you're going to see it shine. So make sure when you evaluate your patient that they don't have really dense tissue overlying that mandible, or your filler is not going to be able to perform. Number 2, tissue laxity. So number 1 was tissue density. Number 2, tissue laxity. The ideal patient for jawline filler, jawline contouring is really, as far as these stages are concerned, my ideal patient is stage 1 and stage 2. Stage 0 has no laxity. They can go home. I tell them come back in a few years when you've aged a little more. Stage 1 and stage 2 are really that sweet spot. A little bit of mild to moderate laxity. They're starting to experience a little bit of jowling. You can add a little bit of filler and it lays beautifully because that tissue is still very healthy and dense and youthful, and it has structure still to it. It has that collagen, that elastin, it has that youthfulness to really carry the filler. And there's not extreme laxity. Stage 3 can be plus or minus, depending on what their tissue looks like. But stage 4 is always, always, always a surgical referral, in my opinion. Stage 1 and stage 2 is really that sweet spot. If they have too lax of tissue overlying the jawline, what's going to end up happening is that filler isn't going to just lift the tissue. Filler doesn't lift. Filler gives the illusion of a lifted appearance, but it's not actually anchoring back tissue. What happens is if they have too severe of laxity, that filler is just going to hang in that tissue like a hammock and weigh it down. So if their laxity is too severe, always a surgical referral. And then plus or minus that stage 3, it really depends on their evaluation, but stage 1 and stage 2 are really that sweet spot that you can get so much bang for their buck and a beautiful result. So always take a look at their laxity and determine, can filler help them? I always tell my patients, we as injectors are not fixing anything, right? We are really smoke and mirrors. That's what we're here for. The reality is that injecting jawline filler, when you have a little bit of jowling, what we're doing is masking or disguising that jowl. We're placing a little bit of filler in the pre-jowl sulcus. We're placing a little bit of filler back here to disguise the appearance of the jowl. Nothing's been fixed. It's really smoke and mirrors, because the reality is that shadows, a change in the light reflex in the jawline is what's really aging us when we are experiencing that jowling, because normally an unaged jawline has a clean light reflex, right? A clean shadow. When we start to experience that jowling, it breaks that light reflex and that shadow doesn't look crisp. So what we do is project that tissue out to almost come up to the projection of the jowl and disguise the appearance of that broken light reflex or broken shadow. And that's what we're ultimately doing. The jowl is still there, but she's masked. So I always explain that to patients so that they don't expect the jowls to be cured. That's not what we're doing. We're really just smoke and mirrors. Really good smoke and mirrors, but just smoke and mirrors. Number 3, when you're determining, is this patient a good candidate for jawline contouring, you have to evaluate their bigonial width measured up to their bizygomatic width. You have to determine if this is a female in your chair, and typically most of our patients are females. If this is a female in your chair, are you going to over-masculinize her, or are you going to masculinize her features by adding jawline filler and performing jawline contouring on her? Because remember, on a female, by guideline, these are just our classic aesthetic guidelines. By guidelines, the bizygomatic width should be wider than the bigonial width in theory, right? And it should have this heart shape or this V-shaped taper towards their face. So bizygomatic width is wider than their bigonial width. If a patient comes in, for example, take me. I have a very square shaped face. I do inject my masseters to give me a little bit of taper, but my bone structure is very masculine on paper. I have a very sharp gonial angle and very square shaped dimensions. If I came to me, I wouldn't say that I was a great candidate for jawline filler, because I think it would ultimately, even if I placed it so perfectly in the more posterior aspect of that gonial angle to elongate it versus widen it. Remember, when we're injecting jawline filler, if you want to masculinize somebody, you can have more anterior injections on that gonial angle to widen them. But if you're trying to elongate that jawline, you really want to go from a more posterior approach on that gonial angle. So getting back to it, by definition, I'm more masculine. So if I came to me, I would say, I think if we were to add jawline filler, I think ultimately we would masculinize you more and make you more square, and your bigonial width and bizygomatic width are almost in line. So I have to factor that in when I'm evaluating my patients. If I add jawline filler, even if we're not adding a lot, we're still adding volume. You have to make sure it's not going to masculinize them and talk to them about it. For the most part, if a patient is coming in just for a little bit of masking of that jowl, you can add a little bit there, but also taking into consideration, if you are adding in that pre-jowl sulcus, you want to make sure you're not widening the width of their chin. Super important. Remember, a male chin or a more masculine chin is in line with the oral commissures. A more feminine chin is in line with the nasal ala, so a little more tapered. So if you are adding volume in that pre-gel sulcus, you have to make sure that you are not widening the appearance of their chin because it's going to make them look more masculine. It might disguise that gel, but now they've lost a little bit of that feminine appearance. So factoring in number 3 is, are you going to masculinize a female by contouring their jawline? Always take that into consideration. And number 4, and I keep saying probably the most important, but they're all really important when it comes to determining if your patient is a candidate for jawline contouring. Number 4 is budget. Any patient, I can't stress this enough, when I first started injecting, any patient that came in with any budget, they're like, oh, I only have a budget for one syringe, but I want jawline contouring. I would always say, like, okay, let's give it a shot and see if we can work some magic. And they always left disappointed, and I always left disappointed in my performance. And the reality is that I was set up for failure to begin with. I always like to use the example of, I can't paint this entire room with just 1 gallon of paint. I need more paint to finish the project. And I tell my patients this, and I give them this example so that they understand, okay, she needs more filler to really work or complete the project. The reality is that this is a large surface area. You have the whole body of the mandible. If you wanted to do a little preauricular volume and gonial angle, it takes a lot of product to contour a jawline. And if you are doing it with just one syringe, a true contouring, you're setting yourself up for failure, and ultimately you're not going to be able to complete the project, and you as an injector are just going to be disappointed in your own performance, even though there was no way you could have done a good job with just one syringe to begin with. So I always tell my patients that if they truly have a budget for one syringe, let's use that syringe elsewhere to get more bang for their buck, or let's go back home and save a little more and save for at least a minimum of 2 syringes to really complete the project. Sometimes I even need 3 syringes for a true contouring, if there's true jowling and all of that. But if it's more stage 1 mild laxity, we can get away with 1 syringe per side. But never, ever, ever at this point in my career do I agree to jawline contouring with just 1 syringe. I always tell them, you're going to end up being disappointed in my performance, and I don't want that for you. So let's use it somewhere else. So in summary, the 4 things that I'm looking for to determine, are you a good candidate for jawline filler, is number 1, tissue density. Do they have a lot of tissue density overlying that mandible? No go. Number 2, tissue laxity. Do they have very severe tissue laxity that's just going to end up weighing down that filler and that tissue, and it's just not going to look good? Number 3, am I going to masculinize a female? And number 4, budget. Do I have enough product to truly complete and perform for my patient? Those are the 4 things that I am looking for. And once they pass all those tests, game over. We're going to get a bomb result and they're going to love it. So as an injector, don't set yourself up for failure. Really set yourself up for success and perform a thorough evaluation for your patients. Also looking into their bone structure, their dentition. Do they actually have a weak chin that's making them look like they have a weak jawline because the chin is recessed? There's so many other things that I can get into because the jawline is truly, you have to treat it from a global standpoint. Multimodality approaches using neurotoxin for Nefertiti lift, platysmal bands, DAO, mentalis. You have to hit it from every angle to really get a true optimal aesthetic outcome. And again, if you want to dive in deeper into all things jawline and really see my step-by-step techniques, take a look at my jawline book. It is a book that I'm honestly so proud of, and I love the videos because I really take you step by step and include some of my complications that I've experienced along the way. So please hit that subscribe button, keep following along, and if you have any questions, comment below.